From Yahoo Finance, this is Electionomics. I'm Rick Newman.
And I'm Alexis Christoforous. On this edition of Electionomics, we are examining how Americans are feeling about the coronavirus pandemic as more economies reopen in the U.S. and around the world, and also its impact on the upcoming presidential election. Joining us on this episode is Dr. Lee Miringoff. He is director of the Marist College Institute for Public Opinion. Lee, good to see you again. I know we have got some fresh data that we want to dive into. Your latest poll looks at how folks are feeling with regards to the reopenings. Are most people embracing these reopenings, happy that they're happening, or are they doing so with some trepidation?
Well, I think that with trepidation is probably the conclusion that you'd want to reach on this. But there's a lot of ambivalence here. I mean, a lot of people are running out of money and unemployment is high, and people are concerned about the economy. But in our national poll that was out just recently, it does show that people are also concerned about a second wave. And that's both true of Democrats and Republicans. Republicans not as much, but more than a majority do think that also. So there's a sense that if we open up too fast, we're asking for trouble. And that's a sense that people have in these numbers. And then also, on the other hand, people are very concerned we're not going to be returning to normal anytime soon. So in a sense, roughly 2/3 of people say, normal is not going to be coming for anytime soon, 6 months or more, maybe, until things become and resemble what they were. Republicans are more likely to think that, in this case, normal could be closer around the corner than Democrats do. But there's a lot of concern, obviously, in the air. And, as we open up all of these things, I think we're seeing in this poll a disconnect between what public opinion is and the direction of public policy. In that people are, worried if things, people want return to normal, are concerned it's not going to happen anytime soon, but they also are concerned about that second wave and what that might mean for healthcare. So there's a lot on people's minds.
Lee, what has the trend been? We're about 10 or 11 weeks into the shutdowns at this point. They began around mid-March. Are you finding that people are losing patience with the shutdowns, or are you finding that people are basically going along with what their governors and their mayors are saying?
Well, first of all, they do have greater confidence in their mayors and in governors than they do in Washington, and certainly that's, they're more trusting of that. But the people are getting itchy, and it depends where in the country you're talking about. So clearly, the Northeast had a major first wave problem, and that's gotten better. So there's a lot of pressure to reopen there. In some states, for lack of a better word, red states, more rural areas, people are, less eager to have had the restrictions in those places where they are, and we're seeing a lot of pressure to open them up. And not necessarily in terms of the protests that we've seen, and whether you wear a mask or not. I think that's maybe capturing a little bit more attention than where people are. It's not that kind of articulation of concern, but you do see there is that concern. On the one hand, we need to get things back to normal because they're afraid that won't happen. But on the other hand, they don't want any more trouble. So I guess the bottom line is, if we're going to return to normal from a public policy standpoint, we better be preparing for a second wave so we don't get into the situation where we had what led up to the horrible number of 100,000 deaths, which is just mind-boggling in terms of the extent of what this has been.
We're less than 6 months now away from the presidential election. We still have to get through conventions, right? We've got the Democratic convention. Looks like it's going to be virtual, but President Trump seems to still be pushing for an in-person one there in Charlotte, North Carolina. And he's given the governor, Cooper, a Democrat, a hard time about it. He's saying that he wants that convention at full capacity. What have you been hearing? What is the likelihood that we get a virtual Democratic convention and an in-person Republican convention?
Well, I think that's a great question. And I think what a wild time it is just politically in terms of having, I mean, we've never had in recent past when we've had these crises, this occurring right in the middle, snap dab in the middle of the presidential campaign. It already impacted the, sort of the end of the Democratic primary season. Biden was on his way to the nomination, but certainly moved that along faster. And then we've had this political communication revolution where it's all being done virtually and barely. I mean, Joe Biden was seen just the other day for the first time, Memorial Day, and the president has done very little in the way of his, rallies. So so right now the Democrats are pointing in the direction of, that they may be doing something virtual. Donald Trump, I think, is trying to, suggest that things are getting better. He doesn't like wearing a mask as an indicator of, problems, and he keeps talking about, the sort of the proverbial light at the end of the tunnel, and that, he's always been more optimistic than the reality of what has happened. And so, yes, right now he's talking about, let's have people in a convention center, where we right now also are discussing maybe some sporting events opening up, but not with people in the stands in attendance. So we still have a ways to go. And I know you noted the North Carolina situation. It is a Democratic governor. They're already about at phase 2 of the federal guidelines on terms of reopening. So they are moving along, but the president has indicated that if they can't guarantee by August 1st that they can have a full-blown convention, that he's going to look elsewhere. Well, that was the other day. I don't know if that's realistic, whether you can just suddenly pull a convention and plop it down somewhere else. But the president is clearly putting, at least in the short term, that pressure on North Carolina to open it up. And I'm not quite sure how that's going to work. Right now we're talking about social distancing, and we haven't gotten past that at the moment. And the public policy of the healthcare professionals is social distancing and masks. And if you have a convention where the president is not wearing a mask and people are sitting next to each other, you're not having either of those two conditions being met. So things are going to have to change dramatically between now and August to have that.
Do conventions even matter in terms of the candidates getting voters to know them? I mean, everybody knows who Trump is at this point. Most people know who Joe Biden is. Would anything change if we just didn't? I mean, I'm putting aside, for what the party business that needs to get done. The public doesn't really care about that. So would it matter to the public if there were no conventions?
Well, it would matter a lot to the media who gets to cover them, and to people like us who get to poll on them and things like that. Let's talk about this in the bigger context of Donald Trump versus Joe Biden. How many people are going to be persuaded between now and November about which of those two they want to vote for? I don't think this is going to be a campaign about persuasion as much as it's going to be about enthusiasm and turnout.
Well, you're the pollster. What is that number? I mean, there is a number, right? Even though it's small.
Yeah. Well, right now, most people have pretty much made up their mind, and you're or sort of in the Trump corner, or you're in the Biden corner, which right now means you're not in the Trump corner, probably more than you're in the Biden corner, but that's different. That right now it's a referendum on the president. He needs to make it a choice on the two of them, between the two of them, and that's what he's been trying to do. Of course, he wanted to do that with a strong, healthy economy, and kind of like make Joe Biden part of the swamp, and Hunter Biden as the evidence of that. Well, the economy was booming. Well, that is all old news in terms of what his strategy is. So yeah, there's going to be persuasion, but if it's 10%, that's probably a lot right now. I think it's more about the turnout, and the president is trying to get a greater turnout among a part of the electorate that's actually been shrinking, where the Democrats are hoping, just to, do a little bit better among those parts that have been growing demographically. So it's a wild time when you talk about an electorate that's pretty much a 50-50 nation. We're already saying, well, what group matters? What state matters? Well, if it's all that close, They all matter.
But I want to talk about that voter turnout because it's still unclear what that's going to look like, right? Are we going to be able to go and vote in person? I know
Sure.
President Trump hopes that that's the case. But did you, in your poll, talk to folks about what happens if it's a mail-in vote in their state? Do they vote? Do they not? And is that falling along party lines?
Well, what you see in the case of the mail-in vote, I mean, first of all, again, in the context, had roughly about 25% of the electorate voted early this way last time. The expectation is that could go as large as 50%. And we're talking about people who, are comfortable with the mail-in voting being driven, of course, by the coronavirus and not wanting to do what happened in Wisconsin too long ago. But the Republican base is the least likely to want it. In other words, who's the strongest Trump backers? Those are white men without a college education. They're the ones who are least likely to want mail-in voting. The people who are most likely to want it are the strongest of the Biden base. Those are women in the suburbs with a college education. So we have two extreme groups here and slugging it out. So there is a partisan difference. And clearly, this is part of what 2020 is all about. And how people are voting has become even more than the political football it's been in prior elections. It's just dramatically so this time.
Well, that, to my mind, raises a very interesting question about sort of risk-taking willingness. Do you have any idea? So you just identified a group more in favor of mail-in, and another group least in favor of mail-in. Do you have any idea which group is most likely to go vote in person if there is a health risk from coronavirus? In other words, is the Trump base more likely to show up to vote even if it's risky, more likely than the Biden base would be willing to show up even if it's risky?
I mean, to vote in person. I would say, we don't have good numbers on that right now. My sense of it is the answer right now would be yes to the Trump support. And we see that even in some of the protest activity. But I don't think that's the rank and file Trump supporter either. I think that's a group, a small group in his corner that is voicing just pleasure with the shutdown. And I look towards the next couple of months to again, so much is likely to change. Right now, the enthusiasm for the Trump base is stronger than the Biden base is for Biden. But that's okay for Biden, because if you have an incumbent, you can make this a referendum on the incumbent and do very well. The president really wants to make it a choice and get away from a referendum, and you're going to see him try to bring Biden out of the basement, literally, and into the campaign fray, and that's what we've seen more of. And I think we're going to see the president's strategy being that a lot of that down the road. So I think that's probably the single most important question that we would like to have an answer to is, who's going to really show up and where's that enthusiasm going to be? And in the months that exist between now and then, and the conventions and presumably the debates, although there's no guarantee there'll be debates. So one might want virtual and the other may want in person. I mean, we can see that dynamic playing out. There's a lot of issues that are still going to be resolved. We have a vice presidential pick on the Democratic side also, which will probably be sooner than later.
So Lee, you've referred to the uncertainties from 2016 and the surprise that happened there. So I'm covering the campaign, and I go on our shows and other places, and I say, oh, Biden's now up to a 10-point lead or whatever the latest result is. And people say, whether it's our anchors or just people out in the public, why should we believe any poll? The polls were completely wrong in 2016. So why do polls even matter in 2020? So I'm sure you get that a lot. Can you explain, I mean, in a very concise way, what happened in 2016 with the polling? And if anything has changed in the industry, or if it's like there were any acknowledged mistakes that have been fixed or whatever?
Yeah, well, unfortunately, that you probably get a 3-credit course at Marist College to get a good answer on that. Let me give you a little tease on it. The people who had the biggest influence on the perception that Hillary Clinton was going to win were these prognosticators. It started with 538, the Nate Silver group in 2012. And by 2016, Huffington Post, YouGov, everybody was getting one of these models that said there's an 80% chance that Hillary Clinton would win. There's a 96% chance that Hillary Clinton would win. And that's what was really shaping it. They were based on the polls, but they were based on models that used the polls to come up with those conclusions. They didn't point out that if there's an 80% chance that she was going to win, there's still a 20% chance that she wasn't. And some of that was missing the state by state analysis. The national polls were all spot on. We hear about shy.
You mean in terms of popular vote, right?
Yes, the popular vote, our poll was 2 points for Hillary Clinton, and it was 2.5 or thereabouts. Most of the national polls were fine. A lot of the problem with the state polls were that they either were not in the right states. In other words, there was a sense of Hillary Clinton was going to run up the score, and let's look at some other places. So we didn't get a sense of what was going on in Pennsylvania, Michigan, and Wisconsin, which turned out to be critical. Or they had, the change was towards the end, and timing is very important in polls. The consumer this time should always look at when the poll is conducted, because that's so very critical. And polls that were done before the Comey letter, for example, in 10 days out. And we know from the exit polls that the undecided people who disliked both Clinton and Trump went overwhelmingly for Trump at the end, and that created that narrow margin that he needed to win. So probability and the chance.
Just a quick follow-up, and then I'll let Alexis get back in here. Has anything changed in terms of polling methodology, whether yours or others you know of, to do things, for example, like be more representative, you know what I'm trying to say, of the states that matter, or anything like that? Or are they basically the same methodologies as in 2016?
Well, here's what people are doing. They're saying that the polls missed lower educated people, and therefore they should weight by education. And to me, that's fighting the last war. I think that works in a state where you have a fairly homogeneous population, so you can get a representative sample. So after some folks in New Hampshire went back in the general election and reweighted by education, and voila, they got it on the nose. So they nailed it, and they were very happy about that. And that sort of led to the view that, everybody should weight by education. Our feeling is that, it's more about geography. It's more about a rural versus an urban versus a suburban vote. And that's where we have to be looking at. And in states that are diverse, more diverse, like the Midwest, not like New Hampshire, we need to be looking at the geographic, the political geography of the state, and then looking at that more specifically. So I don't think it's a one size fits all in terms of education. And I know most of my colleagues are saying, oh, no, let's fight that last war. And let's just adjust all of our samples by education and model it that way. And I think that's dangerous, because there's no guarantee at all that 2020 is going to have a similar slice of the electorate that 2016 did. So my recommendation is, to look at the geographic distribution. We know what the red states and red areas are, and they're getting redder. The blue is getting bluer. We know that the suburbs are so critical. Let's look at those three distinct regions, and education's a part of that, but the situation may not be that dire that we need to sort of start tinkering with models that, we're pretty decent for the most part.
Lee, I know you've got Marist National Outlook Index, first time ever. I want to get to that in a moment, but I want to throw this question at you, and I don't know if you really have any data to share with us, but I am curious. There have been polls showing that Trump may be losing some of the folks that helped him win the first time around, seniors and also educated women. But there's another group I'm curious about, and that's young first-time voters. My son among them. He's graduating from high school. He's going to be able to vote this November. He's looking forward to doing that. Any idea whether or not that base, that those people are going to be more incentivized, less incentivized to vote? What are you hearing about them?
We're hearing exactly what you're saying. I mean, clearly when you look at older folks, they're more concerned about the healthcare side of COVID-19 because they're not necessarily in the workforce right now, and they're very concerned because clearly the elderly are more seriously in jeopardy from this virus. So yeah, so the elderly, in some places may not be as happy with the president as they were in 2016 when he ran up the score among older folks. But then we also know that, Joe Biden may not have, a lock on younger voters. So in a sense, yeah, at the margins, this may be a little wrinkle in an election that is likely to be close. I mean, the answer to the question, who matters, is they all do. All the groups matter because the turnout and the support from each of these groups will be critical. Right now, we're seeing exactly what you are pointing out. There is a sense that the president is a little softer on the elderly than he was, and I think we understand why. And Joe Biden hasn't really captured the enthusiasm of the first-time voters. He's likely to carry them, but not the kind of numbers that you would expect a Democrat to be doing.
I want to jump in there with that National Outlook Index real quick. This is the first time Marist has done this. What did you look at exactly? And can you give us, with the time we have remaining, just a couple of big takeaways from that?
Sure, I'd be very happy to. First of all, it's based on the national surveys we've done on the economy and in healthcare. We asked a whole series of questions to people and asked them to respond on a scale of 0 to 10. I don't know if you need to know all that kind of stuff with the methods, but it's a scale to create an index. And what we're seeing is, yeah, there's a sense here of people having some confidence in their health. I think there's a concern about where that's going to go down the road. But when it comes to the economy, there's a lot of concern about that. Leading that indicator is that the jobs right now are not easy to find. And I think people are literally starting to run out of cash. And that's where the pressure is for the reopening. So what we see is, if you want to look at a 0 to 10, and the first three, 0, 1, 2, 3, are low, and the middle 4, 5, and 6 are sort of so-so, and things are going great at 7, 8, 9, 10. What we're seeing here is numbers that are in the middle, between 4 and 6. And we're seeing that the economy as an index is hurting more so than people's sense of healthcare, because they are comfortable with that. Although they feel there's a risk to their healthcare, they feel that is more under control right now than the economy is. At least they think that they have that control. In the economy, it's kind of like a free fall, and it's been such a dramatic change in the economic outlook. I mean, look what we've got here. We've got an economy that, where we've had this enormous unemployment, and we've had these enormous number of fatalities on the healthcare. And so we felt this index, and we're going to do this repetitively over time to see how we start to dig out, how we recover, and whether people's views on the economy and the healthcare change as a result. So we think it's an important step to get a better sense of public opinion.
So Lee, let's say if the economists are more or less right, and we are bottoming out right now, and things are going to be improving in the fall, but they're still going to be a lot worse than they were a year earlier, do you think voters are going to, in general, going into the election, feel better off or feel worse off?
Well, they'll feel, there's two parts to that. The question that Ronald Reagan asked way back when, are you better off now than you were 4 years ago? People will say no to that, because clearly there's a big problem in the economy. Do people feel that the future might be better than it is currently? Well, that will be an answer we're going to find out in the next few months. And that's an important voting determinant, also voting indicator. So if people think that we're in the right direction, then to go back to Ronald Reagan in 1982, the old stay the course argument, that we've turned the corner, let's stay the course. And that could be a potent argument. What I think is very interesting right now is that Joe Biden is doing very well on things like empathy. He's doing better on handling the coronavirus. He's doing better on healthcare. But Donald Trump is still holding his own, not as good as it's been, but on the terms of the economy. What happens in October and right up to election? Are people going to be more concerned about the economy or healthcare, and more worried about which one of those? And right now, that could tell us a lot about which way that election will go, because Joe Biden is sort of stronger on healthcare, but the president still is holding his own on the economy. That's why this indicator, this index that we put together, I think will be very telling to help us better understand where the electorate is. And I'd love to provide that information to you and your audience as we get down the road. Is that just too garish?
Lee Miringoff, Director of the Marist College Institute for Public Opinion. Thanks for those insights. We'll definitely be talking again between now and November, that's for sure. And thanks everybody for joining us on this edition of Electionomics. Be sure to follow me at Alexis TV News, and Rick?
And me at Rick J. Newman. And of course, I know you'll be as nice as you always are.
All right, everybody. We'll see you next time. Thanks.